Hi everyone, and welcome back to my YouTube channel. I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about how to reduce jaw joint noises. This video is about how to reduce these noises, not eliminate them. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button as I post a new informational video every Friday for people who are suffering from TMJ disorders. For those of you who don't know me, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. Please be sure to check out the links below if you want to hang out with me on my other social media platforms, particularly Instagram. I like to post lots of useful information, tips, trivia, fun facts for those of you who like to nerd out on TMJ information like I do. So let's get right into it. The jaw joint noises that I'm referring to in this video are clicks or pops, which are essentially the same thing when it comes to what's happening inside the jaw joint itself. Inside of the jaw joint, there's a little disc of cartilaginous tissue called the articular disc. This disc of cartilaginous tissue sits between the bony components of the joint. The bony components consist of the little knob that our mandible terminates on. That knob is called the condyle, and the temporal bone, which is a skull bone. The little disc of cartilaginous tissue, the articular disc, sits on top of the condyle, kind of like a hoodie. And in an ideal situation, when we go to open and close, that disc stays on top of the condyle. It stays where it's supposed to stay, and there are no clicks and there are no pops. When that disc comes in and out of alignment, that's when it'll click and pop. This animation shows the little blue disc coming in and out of alignment. Click, pop, click, pop. When this disc comes in and out of alignment, there's an audible and usually palpable click or pop. Again, the same noise. And this is the noise I'm referring to in this video. To better understand the relationship of the articular disc and the condyle and exactly what those are anatomically, please watch my video, Jaw Joint Noises, Snap, Crackle, Pop, which I have linked above. This is my most watched video for a reason, with over 30,000 views at this time. There are diagrams that show the anatomy of the jaw joint and explanations as to exactly why jaw joint noises happen. There are 3 ways I know to effectively decrease jaw joint noises. So I'll list them off and then I'll circle back and go through each one in detail. The first is the 6x6 exercise. Second is Ligaplex I and II, which are supplements. And third is custom orthotics combined with myofascial release and osteopathic manual jaw manipulation. First, let's go over that 6x6 exercise. So for this exercise, you actually bring your teeth edge to edge, as if you're biting off a thread. So if you're having trouble finding that position, it really helps to look in the mirror. Once you bring your teeth edge to edge, you're going to open as big as you can, not so wide that you're hurting yourself, but pretty wide. You're going to open as big as you can and then go back to that edge to edge position. You're going to do this 6 times a day. That's why it's called the 6x6. What this does is when you bring your teeth edge to edge, you're actually moving your jaw forward for most people. Once you bring your jaw forward, that improves the relationship of the condyle, the bony knob the mandible terminates on, and the disc that's displaced, causing the clicking and popping. So it improves that relationship, allowing the disc to remodel and get back in alignment over time. One thing to keep in mind with this exercise is that it does not work quickly, unfortunately. It can take several months or even years to decrease jaw joint noises with doing the 6x6 daily. So do keep that in mind and don't expect overnight results. So the next method involves Ligaplex I and Ligaplex II, which are supplements. Some jaw joint noises are present due to loose ligaments within the jaw joints. Ligaplex I and Ligaplex II help to tighten up these loose ligaments, and they also help to maintain connective tissue health. Ligaplex I is largely recommended for people whose jaw joint noises are acute. They're newer, they've been present for less than a year. Ligaplex II is typically recommended for people who have more chronic jaw joint noises, meaning they've been there for longer than a year. I've linked Ligaplex I and Ligaplex II in the description box below. And keep in mind that just like the 6x6, this is not a quick fix. It can take several months or years to reduce jaw joint noises with this method. So lastly, let's talk about custom orthotics, myofascial release, and osteopathic manual jaw manipulation. Custom orthotics actually hold the jaw in a different position in three-dimensional space, improving the relationship of the condyle to the disc within the joint. Myofascial release is a technique that releases tightened tissues that can be contributing to the disc staying out of alignment. And osteopathic manual jaw manipulation is a very specific technique of manipulating the jaw that also helps improve the relationship of the disc and the condyle. These methods, when used together, actually work the fastest, and this can help decrease or even eliminate jaw joint noises within 4 to 6 months. For some of my patients, we're actually combining all three. I ask my patients to do the 6x6 exercise at home. I ask them to take the Ligaplex supplement, and we check the orthotics, we do the myofascial release and the osteopathic jaw manipulation weekly or bi-weekly. Combining all of this has proven very effective for many of my patients. So that's really it, my friends. I truly hope this video is helpful to you and that it helps reduce those jaw joint noises that can be troublesome, annoying, and even sometimes painful. If you like what you heard or you learned something new, click like below, subscribe to my channel, do all the things. As always, questions and comments are welcome in the comment box below. And remember, my friends, you can never have TMI about TMJ. Thank you.